In theory, everybody is affected during cold weather, but there are certain people who are more at risk. And those are, for example, the elderly, it's the very young, it's people with chronic diseases, the homeless, and accidentally being intoxicated by alcohol, for example. And our results have shown that people are more dying in the Mediterranean countries from cold exposure, because most likely their houses are less insulated and less kept warm inside than in the northern countries. There are very many measures you can actually carry out to prepare yourself and your family for the cold weather. There are non-medical issues, and there are those issues you can do from a medical community. Now, in particular, look up whether your house is well warm, whether you have at least one nice room warm between 18 and 22 degrees, whether your water pipes are not freezing down, and that your indoor heating works properly and enough ventilation is made available in case you're using fossil solid fuels, which in theory should be avoided. The other issues, which are more the medical related issues, is that check your medical status. If you're a chronic patient, for example, get your medication checked and ensure you have enough medication available in your house during an emergency. But also look up the flu vaccination and other types of vaccination you might actually be needed. In the case that you're a person over 65 years, ensure there's somebody of your family around or a social worker around who could actually help you, even in doing the very simple things like shopping, like getting your food into your house, and salt available just to avoid slippery on the pathways in front of your house. There are also other issues you might be thinking about, which are, for example, when you are working outside or you are passing many hours outside of your house, to avoid the consumption of alcohol, but also to be very properly dressed and try to avoid to be alone in a sports activities, but try to be with a group of people so that in the case of an emergency you could actually be saved. And look out when you have early signals of frostbites, for example, or any other types of signals which require medical assistance. Of course, beyond the normal measures like keeping your hands, your head and your feet really very warm, wearing a coat, not too tight shoe work, there are a number of measures you can take outside, for being outside. I think the first issue to mention here is that cold weather can reduce your vigilance and your concentration. So you need to take your time to carry out the same activities you normally would be doing. And these are issues you have to be careful about: slipperies, faults, about the eyes on the street, etc., etc. So not being so much concentrated or not so much vigilant might actually put you at higher risk. So just take your time. And the second issue is that we are all invited to carry out regular exercises both during cold weather and during hot weather. But we need also to be aware about the fact of the changes in our blood concentrations and our circulation patterns. So we are putting our heart at a higher strain. If we are not a really fit person, we might need to actually ask for medical advice beforehand. I mean, first of all, during staying inside means also that you have an indoor temperature which is between 18 and 22 degrees. The biggest problem is with chronic patients or with patients which are confined to bed. In those cases, you really need to ensure a good, warm, constant indoor temperature. Now, in the case you do have some populations, for example, in Central Asia or in other countries, which are still relying very much on the use of wood for burning, so you have to be very careful that you actually ventilate properly so that you're not getting indoor air pollution and intoxication from those issues. Another issue which you have to be very careful is carbon monoxide poisoning in the case that you're using gas, for example, for heating indoors. Just if you have a carbon monoxide checker or an alarm bell, that would be extremely helpful to identify whether you're getting to a pollution for this indoor-less, practically gas, which is highly poisoning. Of course, there are some little things we always recommend. It's that keep social contact. We know that the winter can be very dark and you're few hours actually in the northern part of exposure, so try to keep contact with other people, try to engage into a social life as much as possible, and where it is not possible because of a person confined to bed, try to invite as many friends as you can actually to your house. Yeah, in particular, they should be looking during cold weather, and when they're exposed, for example, being outside, they should be monitoring, looking at their fingers and their toes to see whether they're, for example, changing color. And if that is the case, or becoming numb, they really need to seek shelter, any type of warm issues they can get, or get their friends or their neighbors or anybody who is with them helping to get the circulation running. Now, a pale spot on the face or other skin areas is a sign of a cold injury. Warm it, therefore, immediately. If you have chest pain or breathing difficulties, cough or wheezing, seek shelter again and try to avoid to stay outside as much as possible. In both those cases, you always need to seek medical assistance as much as possible. In the case of real cold, severe cold exposure like hypothermia, which means the reduction of the body temperature to under 35 degrees, this is a very highly life-threatening circumstance, and there are very clear medical directions on what to do in that case. So any type of immediate medical assistance which could be getting you to a next rescue or hospital is the absolute only thing you can do. One thing maybe is for rescue workers, which are exposing themselves sometimes to very cold weather to save other people. Take care of yourself and take care of your friend who is another rescuer. Look at easy symptoms like the pale skin or numbness in your fingers, and help each other to avoid that you yourself expose yourself to cold injuries. Now, WHO is preparing measures and advice for member states, both at the regional level as well as the national level as well as the local level. And those measures include the preparation in advance, so the so-called cold winter preparedness plans or cold wave health action plans. And those plans consist in setting up a body which is responsible for the emergency. It does include a very strict cooperation between the weather services and the health services, so that when a cold wave is occurring, an alarm is happening. It includes the cooperation with other sectors so that the streets are free, the emergency management, the ambulances can run, that the social service is activated, for example. It also includes a whole range of measures the healthcare system or the hospitals or the healthcare centers have to take, which include, for example, to ensure the taking care of the chronic patients in order that a diabetes person or cardiovascular accident-related person can actually get medical assistance at any time. So that is these are the very, very crucial issues which the WHO is trying to provide assistance and help and to train and build capacity in our member states. It is to be said, however, the cold exposure is something we have always had. So our healthcare systems in general in our countries are actually very well prepared to deal with the cold, and the biggest problems we have observed were mainly related to homeless people and people really being exposed, sleeping outside to the cold weather, or accidentally because of being drunken, falling on the street and being at risk of cold exposure. So these type of social assistance and the cooperation between the health services and the social services in some cases have shown to be very effective, but in some other cases might need to be strengthened. Another area where WHO has started to be a little bit more active is the whole issues of indoor temperatures, insulations, and what does work and which doesn't cause any harm indoors while keeping the house warm inside or cold in summer times. So there's a lot of work there in that area to do, because not all insulation practices do work best. Okay, so some of them might actually have some adverse health effects over the long time. So this is the type of advice WHO is actually providing. So during emergencies, before the emergencies, after the emergencies, and in the long-term planning.